Jonathan, thanks. 7:31. As students return to school, we are tracking the potential impact of federal changes, vaccine policy changes, and what it means for you and your family.
Yesterday, the Secretary of Health and Human Services, Robert F. Kennedy Jr., announced that $500 million would be cut from vaccine development, including those specifically targeting COVID-19 and the flu.
Kennedy said that mRNA vaccines are not effective in protecting against upper respiratory infections and wants to find alternative solutions.
As the replace the troubled mRNA programs, we're prioritizing the development of safer, broader vaccine strategies, like whole virus vaccines and novel platforms that don't collapse when viruses mutate.
As the administration looks for new solutions, they are cutting top U.S. medical organizations out of the conversation, including the American Medical Association, whose experts will no longer be invited to serve on advisory committees on immunization practices. Joining us now to talk more about the impact of these changes is the president of the American Medical Association, Dr. Bobby Mukkamala. Good morning. Thank you so much for joining us on this really important topic.
Good morning. Thank you for having me. It is an important topic.
Absolutely. So let's start there. How might the exclusion of groups like yours, the AMA, from the vaccine advisory boards impact the nation's ability to address, prevent, even plan for any future pandemics, or where we are right now with upper respiratory illness?
Yeah, I mean, I think it's going to have a big impact, and an unfortunate one, just because, we have experts that get together to kind of look at the science behind things and decide, how is it or when is it that we're going to offer vaccines and what kind of vaccines? And then that needs to get communicated to our patients. And what's the best mechanism for that communication? It's going to be their doctor. And so the groups that represent those doctors, whether they're pediatricians or geriatricians or infectious disease specialists, or represents all of them, like the American Medical Association, how are we going to communicate that if we're not even in the room to see how a decision was made? And that's our biggest concern, kind of getting kicked out of the conversation.
Another part of the conversation, Doctor, is the impact to families. And, students are heading back to school. The CDC is reporting new strains of COVID-19, including an uptick in cases in our area, the DMV. How are families going to be impacted by these changes?
It's one of those things that if there's not a source of that data that we're open to, and that their doctors and their organizations that represent those doctors can participate, at least listen, ask questions, so that then when those doctors go back to their offices and actually talk to these folks that you just described, right, that the kids are going back to school and we have to know what to tell them about how something was decided, but we weren't even in the room to ask questions about how to communicate that, that's a problem. And what's left is saying, well, we'll do the best we can to let you know, and this is what you should do. That just doesn't inspire confidence. I mean, everybody needs to be on the same page to keep our kids healthy, to keep all of us healthy.
So $500 million cut from this vaccine research and development here. What's that immediate impact look like?
It's basically, this is something that's, constantly evolving, right? I mean, I remember, I'm an ear, nose, and throat guy. We heard about COVID when I was in training, and it was not that big a deal. And then boom, all of a sudden, it becomes something that kills 1 million people in our country. And so that changes. And so when we don't have funding to keep up with those changes, that's a big mistake, right? We need to be on the cutting edge of stuff, not something that's going to, create another crisis and then come out, wondering what to do and having to do all that research in a hurry and then funding it then, right? We're already a step behind at that point.
Now, when it comes to public health and patient access, for families who are worried about vaccine availability or future costs, is there anything that they should consider doing now before these changes take effect?
The first thing is talk to their doctors about what it is that you think I need based on my age, based on my other illnesses, what's in my past medical history, current medical history. But then honestly, even if the doctor and the patient agree, but it's not something that is required or not something that is part of, the standard, an insurance company could say, what, based on what we're hearing, from ACIP now, that we're not going to cover it. I mean, that's a big damaging consequence. And so for that, unfortunately, we have to talk to our lawmakers to basically say, hey, this is a problem. This is what we're going through to help take care of my kid or take care of my mom and dad. And that's something that, talking to the doctors and talking to the lawmakers is probably the best way to see what the consequences are of this decision.
You know, I hate to be doomsday here, Dr. Mukkamala, but let me ask you this. What is the worst case scenario, in your opinion, if this goes unchecked?
You know, I don't think we have to go back that far in time to see that worst case scenario. I mean, when COVID first came out, right, and we didn't have a vaccination, and we were, using handkerchiefs for masks and just trying to figure out what we should do, what we shouldn't do. That's something that was a major crisis, right? It had a big impact on our country. And then we got an mRNA vaccine, which is pretty darn new, and kind of figuring it out as we were using it and having science to support it, right? That this is what it can do, this is what it won't do, this is the what went into the research. All of that will now go behind looking for something new, right? I think the reality should be this is what the science shows, this is what it proves, this is what we should do while we're working on the next chapter of that science book. And that doesn't sound like the direction we're going. We're going backwards, saying we're going to go all the way back. We're not going to do this. Let's figure out what we're going to do next. I just don't think that's right. And neither does the American Medical Association.
Really eye-opening and great insight to this big change. Dr. Bobby Mukkamala, we thank you so much. Of course, joining us as the president of the American Medical Association. Thank you, sir, for your time today.
Thank you both.